So let's get started. I am very pleased today to be joined by Gethin Rees from Gwynedd Council and Catherine James and Caroline Butler from Paris. And both are going to be talking about their experiences of sharing data and the work that they've led, which has involved sharing data across organisations. The reason we wanted to put this session on, and which is why I think it's a really important one, is that, you know, data sharing is getting a lot more traction, I think, at the moment. And as a concept, it can be quite overwhelming. I think it's fair to say, you know, there are a lot of factors that you need to consider before you're able to even start that apps, you know, the sharing of data, and it can be quite overwhelming. However, what I'm hoping you'll see today, you'll learn today, among other things, obviously, is that actually it is possible and it is doable, you know, notwithstanding the challenges that you will face along the way. And I'm sure Gethin, Caroline and Catherine will allude to those. So that's it for me. Thank you very much. And Gethin, it is over to you.
Thanks, Suzanne. Thanks to Data Cymru for giving the time on the platform to share some of the work we've done in Gwynedd. So yeah, I'm Gethin and I work for Gwynedd Council, and I work for the Adult Social Services, Services in Gwynedd. And just to give you a bit of background of how we've got to where we've got to with the inpatient and community directory. About 4 years ago, as there is today, really, there was a discussion between local authority and Betsy Cadwaladr, the local health board here, around bed blocking and around older people who wanted care not being able to leave hospital for one reason or another. So what adult department asked me to do was to sit. It was ideal. It was amazing. 2 months to sit in the hospital for 2 months just to have a feel of why those issues were, what was creating those barriers for patients, older patients leaving hospital. So for 2 months, I was based on 2 wards in Ysbyty Gwynedd, and I saw about 74 patients. I saw 74 patients arriving on those 2 wards over those 2 months. And I just followed them in and out of hospital just to have a feel from their perspective, more than anything, of what was delaying their transfer of care from the hospital back into the community. And quite quickly we realised what struck me was that data from the community doesn't follow patients into hospital on admission at all. So if a patient has a district nurse involvement, or they have a care provider or a social worker, the nurse looking after that patient doesn't necessarily know that they have that intervention in the community. And the nurses on the hospital would often say we plan for discharge on admission. And it got me thinking, if you don't know who the social worker is, if you don't know there is a care provider going into that patient's home, it's very difficult to coordinate discharge planning on admission. And it's nearly impossible to plan for any discharge on admission if you don't have the full picture of what's going on in that patient's life outside of the hospital. So what I thought would be a simple solution, by looking at the WCCS, which is the Welsh Community Care Information System that the social workers use, and using the Welsh Patient Administration System, WPAS and WCCS. WPAS are used in the hospital, WCCS in the community. If we can match patients on both those systems through their NHS number, we can see who's in hospital that has a social worker. And I thought that would be a very easy, simple solution for what we needed. And then fast forward 2 years later, going through information governance paperwork, we kind of got to where we wanted. So that process of sharing information between both systems took around 2 years of information governance bureaucracy, and so I'm able to show this afternoon that we've been able to do that matching and how that report as a proof of concept can look when we match information from both systems. So you can go to the next slide. So this is what we've come up with as a proof of concept. So this report is hosted by BCU, but it's available to anyone working in the local authority. So it's a health and social care report, and that any professional can have access to with the right role level security and stuff. So it's hosted by Power BI, and this is how it looks. So this is a screenshot then back in September. It's a live report. So this is a screenshot I did on a day on the 26th of September. And then what you have across the top, I'll just go through how it works. If you go to the next slide, what you have there is patches. So Gwynedd and Morn, these are all. This report is for anyone working in Gwynedd and Morn. The patches in Gwynedd and Morn are district nurses patches, but we are luckily gone to a way of working where care providers in the community have a patch each. So if you go to the next slide, we have around 17 patches in Gwynedd and 3 patches in Anglesey. And if you are a social worker working in Amlwch, which is the first patch on that drop down, you will only see the Amlwch patients, if that makes sense. And then, yeah, if you go to the next slide. So I've filtered out, so if I'm a social worker working in Pwllheli, I've filtered out all the patients living in Pwllheli. This is a live report you can see on the 26th of September of all the patients living in Pwllheli that are in hospital on that particular day. And if I were to look at it today, it would be live. So this gives an idea for the social worker or a care provider or a district nurse working in the community of all the patients in hospital today. If you go to the next slide, we can see that there are 26 patients in hospital, and if you go to the next slide, and one of them are in the ED. ED here use a slightly different system from WPAS. They use a system called Symphony, and we've been able to match patients both on WCCS and Symphony. So if a patient is admitted to ED, they will also appear on this list. As you can see, in that first patient there on the list is in ED. So that's how it would look if you're working in the community. You can see all the patients from Pwllheli in hospital now. And if you go to the next slide, you can filter any patients by site. So when I say site, any acute hospital within BCU. And if you go to the next, you can filter it up by ward. And if you go to the next, so if I am a nurse or somebody working on Ogwen, which is a ward in Ysbyty Gwynedd in Bangor, these are all the patients on my ward if I'm a nurse, and I can see each patient if they are known to a social worker, and I'll go through how that would look, how that would work. So from admission, on admission, a nurse could see which interventions are happening in the community, which gives a better picture of how to plan discharge. If you go to the next slide. So these are the patients matched on WCCS, and at the bottom there, I'll come to that in a minute. We also include patients who are not matched on WCCS, so you can see all the patients who live in Pwllheli who are not matched, and I'll come to the reason why we've got that. So if you go on to the next slide, we've included on the patient's information there D number. So therapists use D numbers to identify patients, so we've included that. So therapists can identify which patients are open to them. If you, next slide, the name there, blocked them out because of information governance. We have the name. Next, you have the patch they're aligned to. And the next one, which site they're on. Next, which ward they're on. Next, what date they were admitted. Next, a care coordinator. I'll come to that in a second. And then if you go to the next, and then you can see there hours of care. So this is data extracted from the community care system, and this tells you how many hours each patient is receiving in care. And if you hover over one of those numbers, if you go to the next slide, it will tell you who provides that care and the contact details for the care provider for those patients. So you can see that patient is receiving 24 hours of care a week, and it's delivered by Cyd-Cymru, and it also gives the number for Cyd-Cymru. So a nurse potentially could go directly to that care provider if they have any questions about that patient. If you go to the next slide, please. As I say, we've also included patients who are not on the community care system. This is to allow any district nurses who might go into somebody's home, but they might not necessarily have a social worker. So we've included that data, and therapists and pharmacists can also see any other patients that might be open to them. You go on to the next slide. So if you hover over the name, we can have a bit more information. We can see the NHS number. We can see the WCCS ID number, the date of birth, the postcode, their admission method, if it was an emergency or an elective. It also gives you a predicted date of discharge. If it's in WPAS, it's not for this patient, neither is the method of admission. And it also, if it's in the WPAS system, it will also give you a GP practice. So again, a bit more information about that patient to maybe able to identify, but give a bit more context about that patient. If you go to the next slide. So that's how it looks. And then if you click on a patient, if you go to the next slide. So I've clicked on the first patient there. It will open another window, another box on the right-hand side there. And what we've included there is for any other professionals that might be supporting that patient to input some details. So if you click on that window, and if you go to the next slide, it will open a SharePoint list, and here we can put in some other details. So the district nurse, for example, can put in their details, their contact details, and I've put an example in. If you go to the next slide, so I've put some fake names and numbers in there of how that would work. And then if you go to the next slide, so there, for that patient, we start to create a directory of contact details for people and professionals who are supporting that patient in the community that each other can see. Because often what we know is that social workers don't know who the district nurse going into that person's home is, or the therapist might not know there is a care provider. So everybody in the community gets to see who's providing support for that patient, as well as the nurse supporting that patient on the ward, being able to have a directory of essential people supporting that patient in the community. What we've tried to pilot in Gwynedd is that one of those people in the community become a care coordinator on behalf of the community for the patient, and that they become a named person that the hospital contacts, rather than the hospital trying to contact each one of these people, that the community come together and decide who's the best person for the community to communicate with. And we've created a space there within the report, as you can see in the column, that is a care coordinator for somebody who's named as a care coordinator, and their contact details to be provided as well. So what that allows us for us to do is that we create accountability, or we create an ownership within the community of who is responsible for pulling that patient out for the hospital to contact. That's the kind of culture we're going after, is ownership and accountability for the discharges in the community as well as the hospital. You go to the next slide. So that's the report in a nutshell, and what we'd like to the kind of work streams we've got to develop the report further is to include data, to extract data from Civica, which is a system used by the district nurses up in Betsi. So we would extract data about the district nurse and their contact details and automate it into the report rather than inputting that data manually within SharePoint, as well as Therapies Manager and Broadcare. Broadcare is the system used to input information about CHC packages. So that data could be automatically pulled from those systems, and we're working in information governance to extract those data from those systems to include in the data. And then we also think we're able to create notification text messages to named people within the report that can receive text messages for when somebody arrives in hospital. So social worker may receive a text when a patient of theirs is admitted to hospital, as well as a care provider. Again, we're working with information governance to work around those issues around that. Because we've got a patch-based model for care within Anglesey and Gwynedd, we're also working with information governance to give access to this report for private companies. We're also WAST has an interest in some of the data. So when a call comes through to WAST, they could potentially see if a citizen has made a call has a social worker. So we're hopefully being able to work with them in terms of them using the system. And obviously there are obvious benefits for child services. Again, the text message is for a social worker who has a child under their supervision could receive text when they arrive at the ED, and there's obvious benefits to that. We also want to link the patches to Dewi's website. So for the patches, we'd like to create a link for those patches that goes through to the Dewi's website that can show which kind of other interventions within the community that could help patients, that could help with discharges. And the ultimate, I think, for me, would be that patients and their family could potentially see the directory for themselves, so they could see the named people and the numbers, phone numbers for the people involved in the care. But that's down the line. That's the report in a nutshell. If you go to the next slide. Yeah, if you've got any questions, I think we're having a question and answer session at the end. And I think now I'm going to hand over to Carolan, who's from Powys, who's going to show some of the work they've done. Thank you.
Hello, Prynhawn da. Good afternoon, everybody. Thanks for having us. My name is Carolan Butler. I'm Business Analytics and Research Manager, and I'm here with Catherine James, who's the Head of Transformation and Democratic Services at Powys County Council. So today we're going to show you some examples of how we use data to improve outcomes for our residents. And we're going to cover how we turn data into insight, how we use data to improve outcomes, and how we are future-proofing our reporting.
Okay. Hello, everyone. So back in 2015, when we started our data journey, we had very little insight. We were reporting on backward performance rather than focusing on gaining some valuable insight into what our residents, service users and the demand was telling us. So we've moved from a position of weakness to one of strength in some areas, but we've still got a lot of work to do in some of our, for instance, social care has a lot of insight and intelligence. Other areas like education have got a little bit more, but we know we've got to do some in other pockets such as housing, etc., as we're seeing increased demand with homelessness, as I'm sure many of you are. So we've grown our own Power BI and SQL specialists, and we've got quite a highly specialist technical team now who've self-taught in many ways. And so this move to business intelligence had to happen. I'm sure it's not going to be a shock that we are quite a rural county. So we cover a quarter of Wales, but we've got a very sparse population with just 26 people per kilometre squared. That small population is just a little over 133,000 people. So our population is aging fast. I think we now have the title of having the sort of the largest one in Wales in terms of our Asian population, and we do have a shrinking workforce, so it's all, you know, nice and shiny. So with such a vast area and this small population, we had to be creative and use the data we have to the maximum. So data is our most valuable tool. It helps us understand what decisions need to be made and where they need to be made. And it ensures we use our resources effectively and providing the right level of care in the right places. So we've been using geospatial analysis, which is just a posh name for the maps that you can see in front of you, for many years. And we're always looking at sort of data in terms of our 13 locality approach. So it's splitting up the county into these 13 areas that you can see there moving around. So they're really named after our main towns, but it includes all the sort of middle street private areas around those, really. So the little villages, hamlets and isolated dwellings around those. So this approach allows us to understand trends over time as well as across place, and it shows differences amongst our communities.
Our locality approach has been vital during the pandemic. Our services use it daily, and now more than ever with the current economic climate, with the cost of living crisis, the war on Ukraine and inflation, known as the triple lock, using intelligence more effectively helps us to ensure that we have a targeted approach to use our finances and resources efficiently. Our team have supported Track, Trace and Protect since the beginning of COVID and are now still using this approach. We're now looking to move more into a health and care protection role in the future. So the different reports that you can see moving around on the screen, like Gwynedd, we use Power BI at Powys County Council, and Welsh Government use these reports that were produced by our team as a national approach for all Welsh local authorities, as they can provide a deeper level of insight. They're interactive, easy to use, and especially for those who are not confident in using the data, it's easy to understand the main issues and draws out the insights. COVID has raised the profile of insight and intelligence and the importance of accurate and timely intelligence at everybody's fingertips. And there is now an increased need for automated, highly sought after data to help us understand what support people need to reach their full potentials. Our insight has helped support corporate oversight across the health and social care arena. It's forged closer working relationships amongst our third sector partners, and the approach has been a proactive rather than reactive approach, looking to intervene at the earliest opportunity to save unnecessary negative outcomes for the service users and reduce the costs at the same time. Now more than ever, with our economic climate, using intelligence more effectively helps us to ensure that we have a targeted approach.
Thanks. So well, it was a little while ago, but back in the depths of the coronavirus pandemic, I suppose in 2020, we worked in collaboration with Digital Health and Social Care Wales. We produced a suite of automated interactive reports that you can see some of them here on the screen. That it helped really bring some insight that had never been seen before. It was a proof of concept which was sort of showing what could be done across Wales. So the data initially came from Digital Health Social Care Wales, and obviously there were certain data sets of our own as well. But we were able to connect to this data, and so it enabled us to see things that we hadn't before. And basically the reports you can see provide visualizations that anyone can make sense of. They're not very tricky, hopefully, to understand. They're appealing, interactive, and they are actually connected to the digital health social care system there. So the data automatically updates, providing real-time information, and also it's something you can use on your phone, not just on your laptop. So you can have it on the go wherever you are. So this data, this is just one data set. We couldn't show you everything, but this helps to make some effective decisions. So at the time, our track, trace and protect reports as well were being used and helped to drill down into things at the touch of a button. So it really helped to identify who needed help and support. It's probably important to add, it wasn't just us using it as well. It was the whole, collective approach. So the third sector, health, etc. Everyone who was working together on that at the time. But it helped them to understand where they needed to focus, because it was a little bit of a crazy time. So this integrated data has allowed better decisions to be made in quite a timely manner. And there's evidence behind them as well. So what you can see here is basically one that we've pulled across, which is showing urinary tract infections. So we had the number of out-of-hours GP records for Powys, and it showed that the number of residents in Powys who had a UTI in 2020, which was the sort of bit we were looking at the time, was just under 1,200 people. And so we knew that on average, a 20-minute GP out-of-hours call in the whole, if you were looking at the UK, at the time costed £70. Obviously, we know it would be higher in Powys due to the sparse population and the beautiful road network that we have. So we put that at a slightly higher amount of £100 as a rough cost. So we worked out that these 1,200 patients, it was costing a minimum of sort of £120,000 for that year alone, and that was just out of hours, never mind the ones that were happening in time. So basically, this information was used by the adult service at the time, and a big campaign was mounted to look and encourage people to drink more, because often some of these things can easily be remedied and not happen in the first place if people are drinking a little bit more. So whilst we haven't got the access to the data, the wider data set, because obviously we only had out-of-hours GP calls, it would be interesting to understand the number of people entering hospitals with UTI. Obviously, then they shouldn't need to be there, but an overnight stay can cost £400. So if you could access this data and understand how early intervention could lead to a reduction, it would be really beneficial to improving outcomes.
So it's from taking that proactive response with ourselves and our partners, from the insight we found within those reports, the hydration campaign was launched in May back in 2020 to take that proactive response to prevent UTIs, and by educating residents on the importance of staying hydrated and encouraging residents to drink more. We produced this video.
Hi, it's Sue Charles here from BBC Wales Weather. I know we've had a tough year and we're trying to do our best to look after ourselves. Drink more water, drink more liquid, or in my case, a flask of hot tea, because it's cold here along the West Wales coast path. But hopefully do what you can to look after yourselves and take care.
Yes, so that video was just one of many different items that we had going on throughout the campaign. And at the time, we registered that the campaign had already reached 66,000 people through social media, and that was only from 64 posts, and there were 636 engagements with those posts overall.
I thought we were going to have to watch it again then. So as mentioned previously, once these reports are produced, they basically run themselves. So they're connected to the source system, whichever database you're connecting up to, and you can update them as regularly as needed. So in some cases, there are reports that we'd want more often if they're social care and it's statutory, things like that. Other ones not so often because the data that timely data isn't needed. So they are self-serve once they've been built. You can publish them on the web. So we do have a wellbeing information bank on our website. So go take a look if you haven't looked at that one. So there are some things that we do publish out for anyone to access, and there's a lot of benchmarking information on there actually as well, Welsh benchmarking. Or if there's obviously sensitive information with Power BI, you can restrict that to a private workspace for specific people to look at, and it doesn't have to just be people in your own organisation. We've got workspaces that we share with, the police, fire, health board, etc. So we can do that partnership working. So the approach for us is sustainable, and it helps us and our partners to plan more effectively using the insight that we do have. You just get to see the bigger picture, not just your small part of the jigsaw puzzle. And it has led to some questions around data and discussions in terms of right sizing, in terms of what is the right level of service, that we're going to give in the right place. And so this insight we have has been valuable, obviously, to social care that you can see here, but it's also going to inform our public service board planning, because our new wellbeing plan, which is still sort of in draft, but one of the big parts of that moving forward is working better together and reducing duplication. And one of the ways we think we can do that is through the insight and intelligence that we do hold. So sharing that, basically focusing on the most important bits, and I'm sure for everyone it would be the cost of living and environmental things around carbon and climate change. So I think for us that's going to be a big one moving forward. So when you layer this data, you do start to build up a picture across the county, and you can really see differences amongst your communities and how you and obviously your partner organisations can support people with things such as the cost of living, etc.
So this piece of work has led to many questions from all areas of Wales. We've presented our proof of concept across Wales in health care arenas and in social care. It is something that would be beneficial for the whole of Wales, and the question now is, how could we help other Welsh authorities adopt this? Our ambition is to move forward into the realms of predictive analytics and to integrate as many internal databases to build up a richer picture of our localities, and actually to drill down all the way and see almost at a household level. We know that the cost of living and inflation is affecting increasing number of households, businesses and services across our localities in many different ways. So it would be really good to be able to drill down and understand how that's looking across our 13 localities.
So we're on the last slide, I think now. So yeah, it was just to thank, obviously we wouldn't have been able to do this project if it wasn't for some of the people listed there from Digital Health Social Care Wales, and obviously people in the services themselves. So just thank you to them. And yeah, there's a link to the Wellbeing Information Bank there if you'd like to take a look. So just thank you for listening, and if you've got any questions, we'll try and answer them.
Thank you very much both. That was absolutely excellent. Thank you very much. We have had a couple of questions in the chat already. They're quite specific. So if I may, I'm going to start with perhaps a more generic one aimed at both of you, whilst our listeners are building up the courage to put their hands up and suggest that they have questions too. So I guess my first question is, if there is something you can kind of hone in on, what would you say was your most, in these projects where you were trying to, prove the concept that you can do the sharing of data and putting all that in place, what was the most useful hack? And I don't mean hack, what I mean is the one thing that you did, no matter how little, that actually had to kind of move the project on significantly. What's the one thing, if you said to somebody, right, this is one thing you kind of want to make sure you do, what might it be? If there is something, I will ask Gethin first, if that's all right.
I think knowing the right people who have got a similar mindset, and yeah, making contacts, making the contacts, I think is really useful, and knowing who's doing what and who can help you. I think that's really helpful. And I think Melis, my manager, has been with the local authority for quite some time, and she could point me in the right direction, and who's good to work with, and and you go and speak to them, so having contacts is good.
Thank you. And Caroline or Catherine, would either of you like to?
Yeah, I think I would just mirror what Gethin said, really. It's really important to have the right people and the right people who want to succeed as well, and having that ambition, and just not giving up, really. Keep going, you'll get there.
Thank you. As I said, we've got a couple of questions in the chat, but I can see that Dav, who's asked the first question, has got his hand up. So I'm going to skip that one until I come to Dav, and I'll come on to the second one. And I think this was asked to Gethin, but I suspect that it's a question that you can both answer. How did you find the quality of the data in the different systems when you were trying to link them? And can you put a percentage on kind of the numbers that you were able to match? Gethin.
Yeah, so in WCCS, I think when we checked, originally 80% of the people on WCCS had the NHS number. So we are missing 20% of the population within that data matching, which is an issue. Another issue we have in terms of the data quality is that if a postcode is not, if somebody's put an O instead of a 0, they will not be put into a patch. So those are missing. But the report kind of is a feedback loop. So if somebody's in hospital and they don't appear on the report we created, at least it gives us an idea of then we can investigate why. Is it because of the NHS number? Is it because of the postcode? And really for anyone using WCCS currently, there is no repercussions for not putting an NHS number in or not putting in a postcode incorrectly. But we are trying to close that feedback loop with this report. So yeah, the data, it's not as good as it should be, really. But hopefully this report can, as I say, close that feedback loop somewhat.
And Catherine, Caroline, did you have similar issues?
Data quality issues. I suppose it's all dependent on, I was just thinking, in some cases recently, isn't it, Caroline, you've just assisted our health and safety team with some information. They haven't got a swanky big database like WCCIS, but actually the insight that they've derived from that's made them realise that they're overdoing certain mandatory training. With we've stopped doing manual handling now in some areas because it's not really something. So sometimes you can find things that you don't know are there. But I think it just depends on the source system that you've got in the first place, because sometimes things are set up in a better way that you haven't got those like rubbish, when dates of birth and things go wrong and someone's sort of died in a year that we haven't even had yet. But they can have quality things inbuilt to stop that from happening in the first place. I know, Caroline, with the Ukraine information, wasn't it? It just depends on what you're looking at, which database and data that you've got.
And I think as well, one big thing that has happened in Paris from back when we didn't have any reporting services to where we are now, and not to say that our reportings are perfect or anything like that, but there is a huge data culture movements that need to take place in organizations so that every individual can understand and buy into that actually it doesn't matter if you're Joe Bloggs entering one tiny piece of information, actually that information gets all pulled together. There's the golden thread all the way up, and actually what you're entering there is going to be built into the entire corporate plan. So it's getting that culture all the way through from the top down and making sure that everybody understands that what they are entering is an asset in itself, and that it is very important that it is done correctly.
Absolutely, couldn't agree more. So I can see that Dav has his hand up. So Dav, I'm not going to cover the questions you've asked in case you're going to. If you can put your microphone on and jump in.
Yeah, no, I didn't realise how granular that was going. We can ignore that. Not
Okay.
a problem. Yeah, just on the basic concept of sharing, really. The reports seem to be in Power BI. So there's two things here for me, which is how are you sharing those reports? And then if you can't use Power BI, how do you then share the information? Obviously, you made that video, which is obviously based on the underlying stuff that you understood from the work. Then is there, if Power BI doesn't work, how do you share then the information? And then more interestingly, with sharing is kind of like showing people what's possible. Have you had any experiences of people going, oh my gosh, this is terrific, we need more, etc., etc.? And if so, is that challenging as well? So sorry, two things there, like how are you sharing, and then when you share, what happens?
Well, the first, but do you want to do the second point, Caroline? The first, she's scribbling. The first point is we probably should have pointed out that we've had Power BI for, yeah, well, it was whenever Caroline started. When was that?
2017.
17. So we've had Power BI for coming up sort of 6-ish years. But to start with, we obviously didn't really know what it was, and no one had a clue what they were doing. So, which is true. So we just used to pay per license. Whereas I think a couple of years later, maybe just before COVID, luckily, we took the plunge and went for Power BI Premium, which at the time it's about £35,000 for the year, but it enables you to obviously do things. But before, you could only publish things to the web, which made it, you couldn't do anything sort of, you couldn't look at, confidential information, have those private workspaces, that sort of element of things. So it does sound a lot of money, and at the time we were like, ooh. But we tried it, and it saved us in cost avoidance alone and target. It's worth its weight in gold. So in terms of sharing, it's not an issue, because if we've got PAVO, our third sector or health board or whoever needs to see it, fire, doing stuff for the public service board or the regional partnership board, as long as we have the email addresses of those people, Caroline, isn't it? And our ICT lot do something, and then Caroline just gives them view access. And it's quite straightforward, actually. And Caroline's got, as things have evolved and we've got more reports, she's actually implemented some quality assurance things there as well, so that there's a report which can show you who's seeing what, and if someone leaves, that we've got all of that in place now as things have grown.
Yeah, so we before we had the premium license, sharing our reports securely was an issue, which is why we ended up going and making that decision as a local authority to pay in for our premium license. So our IT are able to add external people to a guest Active Directory, which allows us then to give them access to Power BI reports, which are stored securely on our server. So they're all completely locked down. We're also have an extra level of security that we are currently implementing, row level security. So with data sets that are on our SQL server, we're able to, depending on the individual looking at it, it will actually filter out what rows people can see in the data before it even gets into the Power BI workspaces, where then we can also control who comes through the door. So if somebody accidentally comes through the door that shouldn't be, they actually wouldn't be able to see any data anyway. So we've almost got that kind of double lock going on to make sure that our governance is overseen. In terms of coping with the demand, that's one thing that we have seen. As Catherine said, we've been using Power BI since 2017, and before then we were using SSRS. We still use SSRS for a lot of reporting now, as we're integrating across into Power BI still. So that would be our backup if something wasn't working on Power BI itself. But one thing that we have learned, and especially since 2020, since we rolled out Premium and since the coronavirus pandemic, is that thirst for data. We are able to turn reports around very quickly when it's asked for us. And in some respects, that is a bit of our own downfall, because then the demand is higher for that. And actually, the more we open up our data, the more people start asking questions. So it is serving as a bit of a round. So we have to be careful that we have a phrase called our digital debt, to make sure that we're not kind of over exceeding some of our report levels, because not only are we producing new things, but we must maintain the current ones to the best standards.
Yeah, for instance, at the moment, obviously the census 2021 data is all being sort of released in bits, isn't it? So that's something that you're looking at, and they're doing a bit of an analysis, going back and being able to look at how things have changed. So we've got a Welsh language one, for instance, haven't we, which you can really delve into and see lots more. So I think as you move along, I don't think you should try and set out to do some gigantic thing. It's all bite-sized pieces, as Emma always says, chunk it up and start small, and then as you go along you'll change. I know that the reports that you first did, which we used to think were amazing, look quite sort of don't look that exciting now as things progress.
Thank you very much, Gethin. Is there anything you'd like to add to that?
No, I don't think so. No, yeah, we've got some of the issues with row level security, yeah, those kind of things. Yeah, no.
Thank you very much. There is another question that's been asked. What do you think about R as a tool for dashboarding? Have you ever tried that?
Have you ever tried it? Gethin, have you ever tried it?
Don't know. I haven't got a clue what R is. Sorry.
Yeah. So yeah, before my time, the team went on our training, and then after I arrived in the team, they went on our training again. But we still haven't used it very much. We've done some really, really basic things on there, and I know that you can actually integrate R into Power BI as well. But if we're looking at predictive analytics, we're actually exploring Azure and moving our things into Azure, and we're going to be looking at predictive analytics using that software.
Yeah, so yeah, we didn't get on with R very well. It's a long-standing internal joke. We had some training off someone, quite a few days worth of training. I don't know. I'm not. It seemed very complicated, Yasmin. But maybe if someone knows how to use it, maybe it could be worthwhile. But we are not using it to add.
Thank you. So while we wait to see if there are any more questions, I of course do have another one. It's quite, I suppose, specific, and it was triggered of Gethin when you said that the information governance aspect of the project took 2 years, and I don't think that's a surprise necessarily. Should preface this by saying, obviously, I'm a big fan of information governance. I think it's a good thing. I'm just wondering, was there any specific reason why it took, I'm going to say such a long time, it may not be a long time, such a long time. Were there any specific hurdles that you had to kind of get over, and if so, how did you? And we'll start with Gethin, and I can open it up as well.
I think there is in and of itself, the concept is kind of straightforward, isn't it? We want to match patients who have an NHS number here and an NHS number there, and all we want is the name and the social worker and the ward they're in. So having information governance, understanding the concept was kind of quite easy. They understood why we were doing and the problem. I think what the trouble was then was I think their priority then is I think they're just overwhelmed with stuff. I think and they're being battered from everywhere. Everyone's asking of them, so I think their time is really scarce. I think, and I think that's I don't think they had much of a problem with what we were trying to do. And they've been really supportive. Helen in Gwynedd and Lisa in Betsy, they're really supportive. But I just don't think they have the time to. So I feel as though I'm constantly hassling them, which is, kind of cruel on them, really. But I think I was just constantly sending them emails saying, "What's the latest? What's the latest? Is it being improved?" So I don't know. I think it's just something you need to just having that balance between feeling as though you're hassling somebody and annoying somebody and wanting to get it signed off is a really difficult one. And I think the relationship is really important.
Absolutely.
So yeah, no, I don't know. Yeah, I just feel for them really more than anything.
I think to some extent it's going to sound a bit daft, but I think that's quite encouraging actually, because that's not always the story you hear. Whereas it's not ideal that it's timing, but that everybody is in the same boat. Everybody wants to achieve the same things, and we are all working towards the same goal. It's really, really encouraging, I think. Caroline, Catherine, anything to add on the kind of information governance side?
I think just coming back to the very first question is making sure that you've got the right people with you. I was very lucky when I first joined Powys County Council. I actually had a commuting partner who was the head of governance and information at Powys, which is Helen Dolman. And one thing that she really instilled from me at the beginning was, especially when GDPR came in, was that they're not there to restrict people from sharing data, that they're actually there to help.
Absolutely.
And I think as long as you plan in advance for your data sharing and get those people on board at the right time, right at the very beginning, that is of the utmost importance, really. Getting them on board with your project and what you want to do will help you move those forward faster.
Absolutely, really good advice there, I think. Okay, we've got some questions coming in there, so I have to try and keep up. So the first one I've got here is, how did you initially start the mapping for the systems for the data warehousing project? Now, I'm assuming, excuse my ignorance, that's aimed at Powys, but I could be wrong. Or is it?
Erin, yeah, there was little mapping. So there was obviously a PID and everything that was brought forward in terms of what would be the outcome of the project and investment in it. But the main kind of reason for it was, at the time, children's were in special measures. So they didn't have, there was a recommendation there. They didn't have the insight that they needed around statutory for some of their basic things. So that was the main driver for it. So to be honest, for many years, the team were just working hard to support social care for a long time. It isn't until more recently that we sort of expanded out into other areas. So yeah, for a long time, as Caroline pointed out, Power BI wasn't even a thing, and the team were just connecting to WCCS and then producing some basic reports just on that. So there are reporting servers. They were quite bland, but it was better than we'd had before. Just tables. You chucked in some dates, and then within a few seconds it would spit out a report and tell you the numbers per team. And the spatial analysis wasn't even a thing then. It was just per team, looking at a point in time. But it was better than we had before.
Yeah, I think in the very beginning as well, we do have a mapping team in Powys, but we also have a very talented statistician who works in our team as well. And he used to get a cut of the data, and we'd map that on GIS and just get static one-off maps. And I think that's one of the main things that we took from the first wellbeing assessment, was that we were producing all these maps, all these things, but they were always stuck at a place in time. And that's really where our Power BI journey was born, was because we wanted something that could update, that was interactive for our users, that was useful for people who don't care about the whole of Powys. They only want to focus on the south of Powys or one small area that's important to them. And it was through doing that, really, that we kind of went through Power BI. So we use Bing Maps, but we mostly use our shape maps, which are all kind of jigsawed up from the different ONS, MSOA and LSOA mapping areas.
Thank you. And then we're reading through the questions, and we're going very far down the Power BI route, which is unsurprising, I guess, because both of you are using that as the kind of data sharing software. Can you recommend some Power BI training? It says, just wondering, what Power BI training did everyone use?
Yes, so in our team, we actually haven't had any, well, at the beginning, we didn't have any. We were very much working on the fly. We did get some Power BI training delivered to us from Microsoft. That was as a part of a proof of concept that we were doing with a couple of the other local authorities. And to be honest, I don't think it was worth, we didn't pay for it, but I don't think it would be worth it. The best piece of advice for anybody who wants to get into using Power BI would be to find something simple to do and just go in and learn how to do it. And then once you start, you can build up your confidence and build up your knowledge. I can put in a chat. We get asked this question all the time in Powys. So I've actually got a little email that I just kind of save in my outbox just for that. So I'll pop that in the chat now with just some really useful links of people getting started in Power BI. There's loads of Microsoft things that you can do, and it goes through. And also our favourite YouTube people for accessing that. There's also the Power BI community, which is available as well, and there's loads of things on there, and if ever you get stuck, I've done it before, I'll put a question on there and somebody will always come back and give you some really good help and answers on that one.
I was just going to point out that actually, in addition to what Caroline said there, we do have a Power BI community practice. We host a Power BI community practice exactly for that. It's for Welsh public sector workers specifically, so that you know the restrictions around that. If there's more information, I could pop the website link in the email, in the chat bar, sorry, but we do host a community, much like Caroline says, where you can go along and post any questions, and we've got people there to just share and learn. And you know, whether that's you're kind of starting out and have some questions about where to go, or you know, you're right down in the detail and doing some really exciting things, we're starting to try and, you know, push some of those through as well. So it might be worth having a look at there if you haven't already. Gethin, is there anything to add to in terms of kind of learning and training?
Informatics, to be fair, and BCU have provided all the have done the infrastructure work behind Power BI and how it appears on Power BI. So I'm not an expert in Power BI at all, but I've been on a training quite recently, and I can share details of that for anyone who wants it.
Another thing that we do, which may be of use if you don't already do it, is agile. So use an agile approach and just do sort of a 2-week sprint or whatever. So that tends to work quite well. So you'd have, well, you know, it might not take you that long, but basically working, you know, someone could come along and want some gigantic, huge piece of work done, which can be a bit overwhelming. So break it down, get them to pick their must-have, the Moscow approach, isn't it? Must-haves, could-haves, want-to-haves, and prioritize what do we need first, and then work back from there.
Excellent, thank you. Just reading, trying to catch up on all the comments now. I know there's been some chatter in the comments, questions and answers in the comments, so perhaps we'll just leave those for others to read and see if we've got any more questions. One for Gethin, could you expand a bit on the patch-based model for your approach?
Yeah, so the patch-based, the filter you had on the patches for each area is based on a decommissioning of home care we've Gwynedd Council has gone through quite recently, with the concept of each patch historically based on district nurses patches, I think, having one care provider in each of those patches. So we've done a tender last autumn. So now we're slowly moving a transition to having one provider in each of those areas. So we have in Gwynedd, for example, so we have 5 CRTs, and within those community resource teams, they are split into smaller local patches, with the idea that local teams with local care providers know the area. So we're going to a local based care model, and that's why it's been broken down. The report has been broken down into smaller patches to reflect the community care model, if that makes sense.
Excellent, thank you very much. We have no more hands, and I think I've covered all the questions. Obviously, if I haven't, and if anybody wants to kind of shout and put their hands up, then please do. Whilst we're waiting on that, just in case there was any last minute questions, I was actually going to take the opportunity to kind of throw it back to yourselves a bit by everybody on the call in some respects. Data sharing is likely to be one of the areas that we as an organisation, Data Cymru as an organisation, are going to want to try and help push, help us support. I mean, primarily local authorities, as I said, but you know, this is an area we'd like to be helping you do more and better wherever possible. So what I would say is, if you want to, you don't have to. There is no obligation. But in the chat, if you could just kind of, if there are any suggestions for what you think we could do as an organisation to kind of help move this agenda in Wales forward, then put it there. It can be as big, as grand as you like. I'm not making any promises on what can be done, but I think from our point of view, just this opportunity to gather some intelligence around, like I say, how we might be able to support this agenda be it tiny little niche things we can do, or like I say, kind of much more grand ones, then please let us know, because we are kind of doing this intelligence gathering now ahead of the next financial year and our plans for then. So, you know, anything's possible. Maylis, I've seen you've raised your hand. Do you want to come in?
Yeah, I think this responds to your question, but also to a couple of comments made about how transferable these ideas are. And you'll see from the chat that I've given a contrasting response to somebody from Powys, but that's not surprising, because I think if you're looking at sort of nationally produced data, it's produced in, you know, it's produced and it's reported on in a very standardized way. So it's very easy to compare across. Because of the way WCCIS is implemented in individual local authority areas and individual health boards, even though it's a national system, it's implemented very, very differently. So we couldn't just hand what we've done in Gwynedd over to somebody else and say, there you go, there's the prototype, use it. Because you need to understand the way it's been configured. You know, there's an awful lot of different ways that you could record certain information about individuals in the community, and that would mean that your script for pulling information out of WCCIS to match would need to be very different from area to area. So I just wanted to explain why I'd given a different response, and I'm sure I'm seeing Caroline nod, and you understand where I'm coming from. So yeah, the concept is very easily transferable, but there would need to be some configuration work, and I've been speaking a lot to the HCW about these sorts of issues and what do we really mean by national system, but I won't go into that now, but hopefully that clarifies that point.
Very much. Anybody else want to come in at this point? Raise a comment, raise a question. If not, I will allow you to gain 15 minutes back. And say thank you very much. And I have already plugged, unwittingly or unknowingly or unplanned, I've made an unplanned plug for our Power BI community of practice. It's also worth noting that we also have a community of practice that is dedicated to improving access to data, improving access to public sector data, Welsh public sector data. That, you know, in terms of the kind of conversations that we want to see going on there, or we hope to see going on there, that will be within this field of, you know, what are the challenges? What can we do? Are people doing data sharing? Do people want to do data sharing? All those kind of conversations can happen there. It's the very early days of the community. There's not too much happening on there, but it'd be really good to see perhaps some of these conversations continue in there, or let's start getting some of these conversations outside of this forum and outside of any work we might be doing. Go and have a look at that forum and see if we can start kind of exploring some of these issues, perhaps in a little bit more depth over there as well. So it is worth being aware of those. Other than that, it just remains, I would say, for me to thank our speakers very much, and thank you awfully as well for being able to like withstand the question and answer session. That was really good, really useful. It can be quite daunting maybe at times, but very good. And thank you all for joining us. And hopefully we'll see you next time. As I say, go and have a look at Talking Cymru and see what else we've got coming up in the future. So thank you very much and goodbye.
Thank you.